This is NG tube insertion. So the first thing I'm going to do is I'm going to confirm the order. So Cam Casey is allergic to nothing, and he has an order to insert an NG tube and connecting it to low continuous suction. So once the x-ray comes back and the doctor confirms that the NG tube is in his stomach, I will connect them to the low continuous suction. So now I am going to gather my supplies. I have all my supplies right here, and now I'm going to introduce myself to the client. Knock, knock. Hi, I'm Amanda. I'm going to be your student nurse for today. I'm going to do my hand hygiene. Can you please tell me your name and your date of birth? Cam Casey 12919XX. Okay. Are you allergic to anything like latex or adhesives? No? Okay. Now go into that privacy. Okay, so your doctor has ordered an NG tube to be put in. It's gonna help decompress your stomach. So the NG tube stands for a nasogastric tube, and it's gonna go in through your nose, down your throat, and into your stomach. We're gonna hook it up to suction once you get back from x-ray, and that'll just decompress your stomach. Okay, this procedure is not supposed to hurt, but if it does, raise your left hand and I will stop. Do you have any questions? No? Okay. So I am going to perform a respiratory and a GI assessment on him. Is it okay if I lift up your gown and touch my stethoscope to your bare skin so I can listen to you? Yeah? Okay. I'm going to do your interior, your front lung sounds first. I'm going to take this pill from you. Now I'm going to listen to your lung sounds. Breathe in. Breathe in. Okay, now lift up your gown. Breathe in. Breathe in. Breathe in. Breathe in. Okay. Now I'm going to listen to your posterior lung sounds. I'm going to lift you up. 1, 2, 3. Breathe in. Breathe in. Breathe in. Breathe in. Breathe in. Breathe in. His lung sounds were clear bilaterally with equal chest rise and fall and symmetrical ventilations on both sides, interiorly and posteriorly. So now I'm going to do my GI assessment. I'm going to inspect. So I do see that he is distended, and now I'm going to auscultate for 1 minute in each of the quadrants unless indicated otherwise. I heard no vowel sounds, so I'm going to listen to the left lower quadrant for an additional 2 minutes. So after listening in the left lower quadrant for 3 to 5 minutes, I can confirm there are absent vowel sounds. And the other quadrants, they were hyperactive vowel sounds. So now I'm going to inspect his nares. I'm gonna look at his skin integrity and his airflow. So I'm going to lift up the head of the bed. I'm also going to palpate him. So okay, his abdomen is soft. On a scale of 1 to 10, 1 being no pain, 10 being the most pain, how would you rate your abdominal pain? 7 out of 10? Okay. So now I'm going to inspect his nares. I'm going to look at the skin integrity and his airflow. So his skin integrity and both nares are clean, dry, and intact. I do see a little obstruction of mucus in his left nare. So now I'm going to assess the airflow. Breathe in. Breathe in. Okay, so his right nare will have more of a patent airflow, so I'm going to insert the NG tube in the right nare. Okay, at any time in this procedure, if you feel pain or if you feel uncomfortable, let me know by raising your left hand. If you are gagging or coughing excessively, if you become cyanotic, which is blue, and if you can't talk or hum, I will also stop the procedure. Okay, now I'm going to sanitize my hands and put on some clean gloves. I'm gonna get my equipment ready. I would use a skin barrier wipe before I put on this tape, but we don't have that, so I will just verbalize that that is what I would do. I'd also use a fixation device but we don't have that, so I will just be using the tape. My glove ripped, and I'm going to put on some clean gloves. Okay, I'm now going to prepare my area. I'm going to open up my NG tube. This is going in the trash. I'm going to put on my Salem slump or my anti-reflux valve. Okay, now I'm going to measure it. So I'm measuring from the tip of the nose to the end of the ear, and then down towards the xiphoid process. So it's at 52, so I will mark it at the 52 spot, 52 centimeters. It's at the 52. So now I'm going to give him some water, and I will educate him. So when I first insert the tube, I'm going to have your head in a neutral position, so just laying like straight. And then once I advance the tube further, I will instruct you to bring your head towards your knees, and I'll have you sip from the straw. It's just water. I'll just have you sip the water from the straw, and that'll help bring the tubing into your esophagus. Okay. Going to lubricate the tubing. Okay. Like I said, if you feel pain and if you're having difficulty breathing, raise your left hand and let me know. Are you ready? Yeah? Okay. 1, 2, 3. I'm ensuring that's not kinked. Okay, now you can lean your head forward and sip from the straw. You got it. We're almost there. He's not gagging. He's not cyanotic. He's not coughing excessively, so I'm going to continue to put the tube further into him. Okay, so now we're at the 52 mark. You did really good. 52. So now I'm going to apply my skin barrier, but we don't have that, so we'll be just using some tape here. There we go. Is that painful? No? Okay. Okay. Now I will mark it again. Throw this away since I used it on him. And now I'm going to pin it to his gown. would now I'm going to dispose of my equipment. I'm going to take off my gloves, sanitize my hands, and then this is when I will call for an x-ray. Now I'm going to put on some clean gloves and aspirate the GI contents and use a pH test strip to determine if we are in the stomach. But you'll also get an x-ray as well. And after the x-ray, I will attach him to the suction. Only if the tubing is confirmed that's in the stomach. If not, it will be discarded. Will be removed. Okay. That's just gonna go in the trash. Okay. Alright, I'm just gonna aspirate the contents. I have around not that much, so around like 2 mLs. That's enough. Okay. Now I'm going to do my pH testing. So it's over the trash can. I'm still in the patient's room. Okay, now this will go to a biohazard bag since it has the GI contents in that, so it's in the biohazard. This is the biohazard right here. And now I am going to do the pH. So I do see that it's around 4. Yep, 4. So we are in the stomach, but like I said, he will have an x-ray to confirm that. Now I will throw this away. Would you like some oral care done? Yeah? Okay. I'm gonna take off my gloves, sanitize my hands. Okay, I'm gonna do some oral care on you. There we go. Now this is going in the trash as well. I'm going to dispose of all my equipment. Take off my gloves. Perform my hand hygiene, and now I'm going to make sure that he is safe. Let me take that towel off of you. Would you like your water? No? Okay. So this is going to go in the trash, and I will put this in the dirty linen area. Okay. The dirty linen. Now I will take off my gloves, put them in the trash. And hygiene. Would you like your pillow behind your head? Yeah? Okay. Alright, look up your head. My bed is in the lowest position. Are you comfortable? Yeah. Okay, his collar is within reach. And his bed brakes are on. So there's this brake. I'm going to put this within his reach. So that brake is on. This brake is on as well. I have my clean hands. this brake is on, and then that one is on as well. I'll just tap it with my foot. There we go. Okay, sanitize my hands before I leave the room. Do you need anything else? No? Okay. Now I'm going to document, and then once the x-ray comes back and it's confirmed that the tubing is in his stomach, I will go ahead and put him on the low continuous suction, and now my skill is complete.